We're starting to see an increase in COVID cases and changes in the variants circulating in New South Wales, which tells us that we're entering the next COVID wave. By looking at all the local information we have and what's happening overseas, we believe COVID cases will rise in the coming weeks. The protection the New South Wales community has from vaccination and previous infection continues to reduce the risk of severe illness. However, the elderly and those with underlying health conditions will continue to be at higher risk. BA.4 and BA.5 Omicron continues to be the most common variants. However, we are seeing a rise in XBB, BQ.1.1 and the BA.2 sublineages. So what can you do? Make sure you're up to date with your vaccinations. This is your best protection, including against the latest variants. Know if you would be recommended to have antiviral medication if you get COVID, and if so, have a plan for how you're going to get tested and how you're going to get those antivirals as soon as possible. As we go through this next wave, we can all do a few things that can protect the vulnerable, including the elderly and those with underlying health conditions. I urge people to stay home if they have any cold or flu-like symptoms and get tested for COVID-19. Staying home and away from places where there are people at higher risk, such as at hospitals and aged care facilities, when you have COVID or any symptoms is essential.